Hello to all my viewers. This is Dr. Dhaval Maheta, and today we will understand how to run survival analysis live tables in SPSS. Survival analysis is generally defined as a set of methods for analyzing the data where the outcome variable is time until the occurrence of an event of interest. Remember these words: event of interest. The event can be death, occurrence of a disease, recovery from the disease, equipment failure, divorce, etc. The time to event or survival time can be measured in days, weeks, years, etc. Remember, we are modeling the time to an event. Let's take an example. You have two treatments, treatment A and treatment B. You might want to find out which treatment leads to faster recovery and how various factors might affect recovery time. Data collection. Treatment A. You treat 15 patients with this treatment. After 6 months, 10 patients have fully recovered and 5 are still undergoing the treatment. Treatment B. You treat 15 patients with this treatment. After 6 months, 8 patients have fully recovered and 7 are still undergoing the treatment. Survival function. This shows the probability that the patient has not yet recovered at different times. So let's understand this. 10 divided by 15. So these are the patients who have recovered, and 5 divided by 15 who have not recovered. So for example, after 6 months, you find that 66% of patients on treatment A have fully recovered. This means that remaining 30% have not recovered, while only 53% of patients on treatment B, which is 8 divided by 15. So 53% of patients on treatment B have recovered, and 47% of patients have not recovered. So you can say that the treatment B takes a longer time period for the recovery. Terminologies of survival analysis. Survival time. The time from the start of the observation period to the occurrence of the event of interest. Example: the time from when a patient starts treatment until they recover. Event: the occurrence of the outcome of interest, that is recovery, failure, or death. Example: a patient recovering from an illness. Censoring: the condition in which the event of interest has not occurred by the end of the observation period or data collection. In short, the patient drops out of the study. So the example, same example I have taken, a patient drops out of the study before their recovery is observed. Types: right censoring, left censoring, interval censoring. So right censoring is when a subject's event time is unknown but is known to be longer than a certain time. Left censoring, when the event has occurred before the start of the observation period. Interval censoring, when the event occurs within a known interval but the exact time is unknown. I'll explain all these concepts in the next slide. Let's specify the start point and the end point for the study window. We are carrying out a study, so we are specifying the starting point and ending point. The time duration, let's say the study will be carried out for 6 months or 1 year. Please remember the symbols. Multiplication sign is representing that the event has occurred, and plus sign means censored. The patient drops out of the study. The first case, we started observing the patient and the event occurred. So when a patient recovers from illness, we say an event has happened. Now, censoring. When a patient drops out the study, it is known as censored. Two scenarios of right censored. We will see right censoring. Patient leaves the study before it ends, so only the lower limit of the time is known. So here the patient drops out of the study, so only the lower limit of the time is known. First scenario. Second, the study ends. See this red line. The study ends before the event occurs. So the event occurred outside the time frame. That is also known as a right censoring. Left censoring, when an event occurs before the data is collected, so before the starting point. So only the upper bound of time is known. This is known as left censored. The patient experienced a severe reaction to medication 1 month before the study started. So that is left censored. Interval censored. An event happened in time which is not precise. So when an event occurs between two known time points, but the precise time of occurrence is not recorded, it is known as interval censored. Basic requirement for survival analysis: time to event data, event time, the time until the event of interest occurs. Example, time until a patient recovers, a machine fails. So that we require. Censoring information is necessary. Details about cases where the event has not occurred by the end of the study or observation period. Example, a patient drops out of a study or the study ends before a machine fails. Event indicator, a variable indicating whether the event of interest has occurred or not. This is typically coded as a binary variable. Example, if the event occurred, that is a person recovered or death, so it is indicated by 1. And if the patient has dropped, censored, so 0 for censored data. Some basic assumptions of survival analysis are: the probability for the event of interest should depend only on time. Cases that enter the study at different times should behave similarly. Second, there are no systematic differences between censored and uncensored cases. Variables under study: time variable, that is duration. It must be continuous variable. Status variable, binary or categorical variable, represents the event of interest. 1 is for the event, 0 is for censored. Factor variable, categorical variable. The survival function is a key concept in survival analysis that represents the probability that a subject, such as a patient in medical study, will survive past a certain time t. In other words, it gives a likelihood that the event of interest, example, death, relapse, failure, has not yet occurred by time t. So the survival function, usually denoted by ST, is mathematically defined as ST is the probability of the capital T greater than small t. So the t is the random variable representing the time until the event occurs. T is a specific point in time. ST is the probability that the event has not occurred by time t. Interpretation: ST gives the probability that the subject survives beyond time t. At the beginning of the study, that is time t is equal to 0, as 0 is typically 1, indicating 100% survival. It means that all patients are alive. As time progresses, an event occurs, ST decreases, approaching 0 as time increases, if all subjects eventually experience the event. Example of survival functions. Consider a study tracking patients after a surgery. At t is equal to 0, the start of the study, all patients are alive. So S0 is equal to 1. At t is equal to 3 months, if 80% of the patients are still alive, then S3 is 0.8. At t is equal to 6 months, if 50% of the patients are still alive, then S6 is 0.5. Graphical representation. The survival function is often visualized as a survival curve, which is a plot of ST versus time t. The curve typically starts at 1 and decreases over time, reflecting the decreasing probability of survival as time progresses. Let's try to understand the concept of survival function by this table. So the first column consists of period. Risk is calculated as alive minus censored. Censored means the patients who dropped out of the study, died, survived, and this is the last column is a Kaplan-Meier estimated survival function. In period 1, 30 patients are alive, so ST is 100%, right? ST is 100%, all are alive. 0 censored means no dropouts, 3 died means 30 minus 3, 27 survived. So the survival function ST is 27 divided by 30.90. In second time period, 27 minus 0. Why 0? The nobody drop out of the study. So 27 minus 0. So 27. 2 died. So 27 minus 2 is 25. Now we will take the ratio 25 divided by 27. So it is 0.9. Third period. 25, that is 25 are alive, 0 censored, 1 died. So 25 minus 1. So 24. So I will take the ratio 24 divided by 25. In fourth time period, 1 dropped out of the study for the first time. Okay, so 24 minus 1, 23. So 24 minus 1, 23. 6 died. So 23 minus 6, 17. So 17 divided by 23, you will get 0.591. Fifth time period, 17 are alive, no censored. Okay, there is no censored here. 2 died. So 15 divided by 17. Now here, 16, you just see here, 16 censored. So 15 minus 6. Okay, 15 minus 6 is 9. 1 died. So 8 divided by 9. In the last period, okay, let's talk about the last period. Nobody dropped out of the study. 5 died. So 8 were alive. So 8 minus 5, 3. Okay, 8 minus 5, 3. And we will take 3 divided by 8. Okay. So there is a small change which I have done here. 8 minus 5. Okay, so this many have survived. So 5 died. So 3 are alive. So it's 3 divided by 8. Now let's proceed further. Life tables. Life tables is a descriptive procedure for examining the distribution of time to event variables. We also can compare the distribution by the levels of the factor variable. The basic idea of the life table is to subdivide the period of observations into smaller time intervals. Then the probability from each of the intervals are estimated. So let's take a case study. A comprehensive study was conducted across multiple institutions. So here are the institutions to examine the factors influencing the survival time of cancer patients. The primary objective of this research was to identify significant predictions of survival outcomes and to develop robust model that could assist in patient prognosis and clinical decision making. Key variables include the survival time of patients in days. So here is it, second column. Censoring status, indicating whether the patient had died or was censored due to being lost to follow-up or still alive at the study's end. So here 1 is dead, 2 is censored, means the dropouts. Age, gender, 1 is male, 2 is female, and various performance scores. Specifically, the Eastern Cooperative Oncological Group's performance score was used to assess patients' functional status, ranging from asymptomatic, that is 0, so here is it, pH ECOG, to bedbound 4. Additionally, the Karnofsky performance score rated both by physicians, so here is the score by physician and here is the score by the patient, rated both by physicians and patients, provided a detailed assessment of the patient's overall health and ability to carry out daily activities, with scores ranging from 0, poor, so here score is from 0 to 100, 0, poor, to 100, good. Other variables included in the analysis were the number of calories consumed at meals, this one, and the amount of weight lost in the last 6 months. So let's see how we can do this in SPSS. We will go in the data view. This is the same data set, the variable view. So the first is institution code, survival time in days. It is continuous. Censoring status, 1 dead, 2 censored. Age in years, gender of the respondent, 1 male, 2 female. ECOG performance, just try to recall, 1 symptomatic, 2 in bed, less than 50% of the day, days, 3 in bed, more than 50% of the days, 4 bed count. The performance score on 0 to 100, calories consumed, weight loss. Now we will go in analyze and survival, life tables. Now transfer survival time in days into time. The maximum time in this is, that is the study window. We started from 0 and the end was 1100, and we want to do the, we want to report on the basis of every 100 days, the increment of 100. Status, so censoring status, enter into status, define event, what we want to study. One is death. So what were our words? The event of interest. 1, continue, and click on options, click on survival, hazard, continue, and click OK. So you got the output. So this is the life table, survival function, and the hazard function. I'll interpret this thing on the slide. I've just taken the output on the slide. Okay, the first column represents numbers entering the interval, the patients alive. The second column is numbers withdrawing during the interval, the dropouts, censored. Number of terminal events, death which happened. Okay, and the last one is cumulative proportion surviving at the end of the interval. Now we will understand how this figures, how we will get these figures. 228 at 0 time period are alive, 31 withdrawn, and 1 death. So 228 minus 31 minus 1, 196. Now in the, after 100 days, 196, 41 withdrawn, 11 death, 196 minus 41 minus 11, 144. 144 minus 29 minus 23, 92. So what we do, we take the ratio of number of terminal events divided by alive. Just try to recall this survival, this table. Okay, survived divided by alive. So we will get the Kaplan-Meier estimated survival function, ST, the cumulative probability. The thing which you have to notice, it continuously drops. So how we write the interpretation? Interval 0 to 100, 0 to 100. All 228 subjects starts the study and only one event occurs. Here is it. Within this interval, leading to a survival proportion of 100% at the end of this interval. So here you get 100%. Now 100 to 200. Okay. 196 subjects enter this interval with 11 experiencing the event, resulting in cumulative survival of 93% at the end of this. So 11 divided by 196, so you will get 93%. 200 to 300, 144 subjects starts with 23 events occurring, leading to a cumulative survival of 77% at the end of this interval. Okay, similarly you can do for 400, 500. I again started from 600 to 700. Here is it. In this interval, no event occurred. Here, no death occurred. So the cumulative survival proportion remains unchanged, 50%, 50%. 800 to 900. 8 subjects enter this interval with 3 events occurring, significantly reducing the cumulative survival proportion to 26%. Now, 1000 to 1100. Only 2 subjects enter this interval, 2 death. So leading to a cumulative survival proportion of 0% at the end of the interval. So at the end of the study period, nobody survived. Now, if any event occurred beyond the time frame of 1100, okay, any death which occurred beyond the time period of 1100, that is known as right censored. 1. If any dropouts took place between 0 to 1100, that is also known as the right censored. But if the death of the patient occurred before our study period, that is left censored. Okay, let's proceed further. This is survival function. It is gradually decreasing. So a survival plot, also known as a Kaplan-Meier curve, visually represents the proportion of subjects in a study who have not experienced a particular event such as death, relapse, or failure over time. The y-axis shows the survival probability, which ranges from 0 to 1. A value of 1 here indicates that all subjects are still event-free, alive, disease-free, and a value of 0 here means that no subjects are event-free. The x-axis represents time, day, that is in days, months, year from the start of the study. Now, what is the number exposed to risk? This column. Okay, number exposed to risk. So, the number exposed to risk is typically adjusted to account for subjects who were withdrawn, censored during the interval. The basic idea is to estimate how many subjects were truly at risk of the event during that interval. So number exposed to risk, its formula is number entering the interval minus half number withdrawing during the interval. So interval 200 to 300, here is it. Number entering the interval 144. Number withdrawing during the interval 29. So number exposed to risk. Number exposed to risk is 144 minus half of this. We'll get 129.5. Here is the number. Okay. Now the hazard function. Hazard function is calculated on the basis of number exposed to risk. The hazard rate or hazard function is a key concept in survival analysis that represents the instantaneous risk of experiencing an event such as death or failure at specific time, given that the individual has survived up to that time. The formula for hazard rate is, for a given interval, the hazard rate HT is calculated using the formula HT is equal to number of events during the interval, number exposed to risk during the interval, where number of events during this interval is, this is the count of events that occurred within the specific time interval. Number exposed to risk during the interval, this we have already seen. Okay, now we will calculate the hazard rate. So this is the graph of the hazard rate, and the last column you will get numbers of hazard rate. Interval 200 to 300 here. Number entering the interval 144, withdrawing 29, terminal events which took place 23, number exposed to risk 129.5. So using the formula, which formula I will use? This one. Number of events during the interval 23, number exposed to the risk 129.5. So 23 divided by 129.5. So you will get 0.177. Here it is 0.00. So it is simply adjusted, rounded off. Okay, the correction has been done and we got the value 0.00. So the hazard rate is 0.00. Now let's generate a separate output, that is a separate survival curve for male and female. And let's see, is there any significant difference in the survival of male and female? So to get the separate curve, what we'll do? Activate from here, live tables. Gender of the respondent, transfer it into the factor. Now we require a coding for this. Okay, so what is the coding which is used? Coding 1 male, 2 female. Okay, let's enter the number. Gender minimum 1, maximum 2. Continue and click OK. So we got it. So the survival curve of male and female separately. Now let's do the interpretation. The cumulative proportion surviving starts at 1 in both the cases. Okay, and gradually decreases with more significant drop starting at 800-day interval in case of male. So there is more steep drop. Just see here, this is blue one is for male and red one is for female. So there is a steep drop in case of female. The sharpest drop is observed between 800 and 1000 days, where the cumulative survival probabilities fall from 0.39 to 0.00. This is the sharpest drop. indicating all male subjects had experienced the event by the end of the study. Female survival trends. The cumulative survival probability decreased more rapidly compared to the males, especially between 200 and 500. See, 200 to 500. Here the drop is from 0.71 to 0.37. And in case of male, it is 0.82 to 0.65. The drop is less. So the survival probability drops to zero by the end of the study, similar to males, but this occurs earlier in the study for females. This means that the survival curve in case of female is more steep than in comparison to male. It means that the probability of survival in female of cancer patient is less in comparison to male at different time intervals. The median survival time, this you will get it from here. The median, here is it. Okay, the median survival time. Now what is the interpretation of it? The table provides a median survival time. Median is 50% for both and female respondents. The median survival time is the time at which 50% of the subjects are expected to have experienced the event, that is death, and 50% are still surviving. The median survival time is 856.548 days. This means that the half of the male participants are expected to have survived up to approximately 857 days, and the other would have experienced the event by this time. Female, the median survival time is 539, very less. So for female participants, half are expected to survive up to approximately 539 days, and the other half would experience the event by this time. Now, is there a significant difference in the survival curve of male and female? We want to check it. So there is a formal test for it. So again, I will go here, life tables, options, and activate pairwise. Compare levels of first factor pairwise. Click here and click OK. So you will get a test. Here is it. The Wilcoxon statistics. Here is it. Okay. Now what is the interpretation of it? First, we write the null hypothesis. There is no significant difference in the survival curve distributions between males and females. In other words, the survival experience of male and female is similar, and any observed differences of the survival time are due to random chance. Now we will do the interpretation on the basis of this p-value. It is 0.075. So how we will write the interpretation? As the p-value is 0.075, which is more than 0.05, which is 5% level of significance. So we fail to reject null hypothesis, which means that on the basis of the Wilcoxon-Gehring test, there is no statistically significant difference in the survival curve between males and females in the study. The observed difference in survival times between the genders could be due to random variation, the difference which we have seen here. Okay, it is just because of the random variation rather than a systematic difference. So the conclusion is longer survival for males. Males have a longer median survival time compared to the females, indicating they generally survive longer in this study, that is the study related to the cancer patients. Earlier event occurrence for females. Females tend to experience the event earlier than males, as shown by the shorter median survival time. This suggests that the risk factors or the conditions influencing survival may differ between the genders, leading to a notable difference in median survival times. So this is according to the median survival time, but according to the test, the difference is not so large. So this was all about how to run survival analysis life tables in SPSS. For more videos on advanced data analysis using SPSS, kindly subscribe to my channel. You can also refer my playlist in which I have uploaded videos on data science, machine learning, and artificial intelligence. Please don't forget to like and share my videos. You can also follow me on different social medias, link given in the description box.